All right, good evening, good morning, good afternoon. I hope you can hear me. My name is Rosemary Mburu, Executive Director for WACI Health, and I'm happy to co-facilitate this webinar with my colleague, Florence. She will introduce herself in a moment from GNP+. But we just wanted to let you know that we'll give it just maybe like 1 minute for colleagues to join, settle in, and then we can get started. But you're very welcome and thank you for joining us. Awesome, awesome. So I think we are good to go and we continue adding colleagues. We have quite a high number of registration. And so we'll keep adding colleagues. Welcome to the Africa Regional Consultation on the UN high-level meetings. This is going to be a discussion on the upcoming TB, universal health coverage and pandemic prevention, preparedness and response high-level meetings coming up later this year in New York at the sidelines of UNGA. This webinar is co-organized in partnership with WACI Health, GNP+, STOPAIDS, the Civil Society Engagement Mechanism for UHC 2030, Aidsfonds, and the Global Fund Advocates Network. And we welcome you. I'm going to co-facilitate with Florence, my colleague from GNP+. So I want to invite Florence to introduce herself first, and then to take us through the logistics and a quick look at the agenda of the day. Florence, over to you.
Excited to be co-facilitating this session and very important discussion with you, Rosemary. Thank you very much, everyone, and welcome to the Africa Regional Consultation on the UN High-Level Meeting. My name is Florence Anam. I am the co-executive director at GNP+, and also co-moderating this session. So just a little bit of quicker updates. Please introduce yourselves on the chat box and we will be able to know who you are. Please note that the consultations will be recorded and we will share the recording at the end of this meeting. There is French and Arabic translation, so please just check on the translation box and pick the language of your choice. We have a very large group of people on this call, so even though we won't have any formal introductions, we see you and we recognize you, so please continue to just give us your information on the chat. Keep your microphone on mute if you're not speaking, and if you have any questions, please put them on the chat or wait to do that during the Q&A section. So a quick run through on the agenda. My colleague Rosemary will share with us why we are here today. And then we will get on to the next segment, which is an update on all of the 3 high-level meetings and their speakers to give us an overview and update on the modalities. And then we will have a little bit of a Q&A session after the presentations on the 3 high-level meetings, TB, universal health coverage, and pandemic prevention, preparedness and response. After which, we will have a conversation with you around organizing ourselves within the region, what the processes are, and how you can all participate and engage. And then again, have a conversation around how to put together our key asks. So we are looking to have civil society statement at the regional level that will link with a civil society statement at the global level. We will go into breakout rooms and we'll discuss this and let you know how to do this at this moment. But just be on the lookout that we will get into some organization around key asks. Then we will get into the next steps and we will inform you about how to get these statements going and how you can engage in the pre-meetings and the multi-stakeholder hearings coming up in May. So welcome again. Without wasting more time, handing it back to you, Rosemary.
Thank you, Florence. How exciting that we get an opportunity to come together as advocates in the global health space, and particularly have an Africa-focused conversation. I think for me, it's very important because a lot of times we see the high-level meetings as something that is happening in New York. Florence, you can imagine your first high-level meeting. When you are sitting at the country level, when you are sitting at the regional level, it's different. And sometimes we miss the opportunity to get our voice heard because we are not able to either be in New York or we do not know how to actually participate in these processes. So today we have on the call colleagues who have really been working on this. So we have colleagues who are leading on the community and civil society hub for the TB high-level meeting, which is hosted by GFAN. We have colleagues here from the Civil Society Engagement Mechanism for UHC 2030 who have closely been following the UHC high-level meeting. And we also have a group here of colleagues who have been really active on the PPR conversations in the lead up to the high-level meeting. So I think it's a really good opportunity where you could almost say the national and the regional meets the global to actually come together, but it gives us an opportunity to reflect to what is happening at country level, at regional level, but also to understand the process and how we can come in either from a national level or to a regional level, just to understand even the process, the modalities, what is expected, how can we come in? What can we do if we are not coming to New York? Is there something we can do? So we are looking forward to having a really great conversation. And so to start us off, I will hand over to the three colleagues who've been really engaged. So maybe we start with Robin and Priyanka in terms of the TB high-level meeting. And then Robin and Priyanka will hand over to Waiswa and then over to Fitum for the PPR. Florence, anything else you wanted to add?
No, you have covered it all. Thank you.
Awesome. So let's hear about the TB high-level meeting. Robin.
Thanks, Rosemary. We'll just get our slides up on screen and then Priyanka will get us started. Hi, everyone. My name is Robin and I'm working with the hub hosted by GFAN on the TB HLM.
Hello everyone, my name is Priyanka and I believe there is someone who is unmuted currently, so I would request you to please mute yourself if possible. And thank you. Thank you so much. All right, so I am representing the Affected Communities and Civil Society Coordination Hub today, and so both of us are here in the same capacity, my colleague and I. The Affected Communities and Civil Society Coordination Hub was created with, thank you, was created with one mandate and one mandate only, which was to be able to support affected community members and civil society members to engage meaningfully with all processes related to the upcoming high-level meeting. So a little bit about our leadership and how we are structured. So we have a leadership group that guides us and provides us direction in terms of taking our work forward. We have representations from all region and also from very specific strategic partners. As you can see, we have two people on our leadership group who are from your region. We have Bertrand Campor and we have Evelyn Kibuchi who are on our leadership group. As Rosemary has mentioned at the beginning of the call, we are in fact hosted by GFAN, but we are also supported by the Stop TB partnership. Now, to take you forward a little bit about the HLM. So what do we know so far? We know that the TB HLM is going to happen on the 22nd of September in New York City. And the format of the HLM is going to be an opening segment, a plenary segment, and two panels, along with a brief closing statement. Now, this is going to be the same format that is also going to be used for the multi-stakeholder hearing, which is happening on 8th of May, but more about that in a short while. So the theme for this year's HLM is advancing science, finance, and innovation and their benefits to urgently end the global tuberculosis epidemic, in particular by ensuring equitable access to testing, treatment, and care. I'm not go into much detail about this, but in case you are interested in going through the modalities document, or in case you want to look through the concept note of the upcoming multi-stakeholder hearing and the agenda for the multi-stakeholder hearing, you can find all of these documents and all the information that you might need on our website. I will pop in the link to our website in the chat box so you can go and check it out, but also Robin will talk more about it in a bit. The HLM is being co-facilitated by two co-facilitators. I'm not going to say their names out loud because I'm afraid I might butcher them. But basically, the roles of the co-facilitator is to be able to ensure a smooth functioning and ensure that the entire process of beginning to the end of having a multi-stakeholder hearing and also a high-level meeting, and then convening all stakeholders and parties to ensure that we have a strong and powerful and collaborative political declaration at the end of the high-level meeting. And this is the agenda for the multi-stakeholder hearing on TB, which I just mentioned, that is going to happen on the 8th of May in New York City. The time of the multi-stakeholder hearing is it starts at 3 in the afternoon, and as we know, this is the year of the 3 HLM, so we will also be having the multi-stakeholder hearing for PPR and for UHC on 9th of May, which is the very next day after the multi-stakeholder hearing on TB. And of course, you will hear more about that as other colleagues present their presentations on this call. So as I mentioned before, we will have an opening segment, two panel discussions, and a closing segment. The names of the speakers on the panels have not been made public yet, but we will be circulating that very, very soon as we have more intel on that. But we can tell you that there is going to definitely be a survivor on both the panels. We will have representations from CSOs on both the panels, and we will also have representations from private sector partners and from the academicians and research cohort of stakeholders, and so on and so forth. So how can you engage if you are not at NYC or at New York City? If you are not physically present there, does it mean that you cannot engage, or is there no way for you to make your voices heard? There definitely is, and that's what is the primary function of the coordination hub. We are here to support you, and we are here to ensure that the voices of affected community members from across the globe are heard and accounted for. And I'm just, with that thought, going to turn it over to my colleague Robin to take us further and give us more details. Over to you, Robin.
Thank you, Priyanka. So next slide, please. So really, the opportunity of the hour is for us to be influencing the language and the commitments that will be in the final political declaration document, which is the outcome document of the high-level meeting on TB. So this is where we can get strong language around targets and commitments embedded in the political declaration itself, and then ideally hold our states accountable to making good on those promises. So if there's a few different ways to influence the language that's going to be in the political declaration. One of the moments is, of course, the multi-stakeholder hearing that Priyanka just flagged to your awareness. There will be a number of people in New York representing civil society and affected community voices to influence that language at that moment. There's also ways for you, if you're not going to be attending the hearing itself, to engage at the national level. So you can be engaging your missions in New York, even if you're not going to be traveling to New York. You can be engaging with members of parliaments, with relevant ministers, and with your heads of state, putting pressure on them to make sure that the language that they're championing is in alignment with what your key asks are. And making sure also that if your state is going to be a champion in this space, that they show up and make a statement at the hearing itself and champion something new. Okay, so next slide, please. The TB community has gone through a very rigorous process to launch what is called the Deadly Divide Accountability Report. So Deadly Divide 2.0 has just been launched March 25th, and it lays out the key asks for the TB community. You can see them on screen right now. These are the high-level 6 key themes that affected communities and civil society want to see well represented in the political declaration itself. And we're going to dig a little bit deeper into these by localizing these global asks as a region shortly on this call. And wanting to flag that this consultative process took place earlier this year and involved more than 1,000 people participating from 90 different countries. And these core asks are being built on the global plan to end TB and a previous effort in developing a Deadly Divide 1.0. Next slide, please. So at the Hub, we're here to support your advocacy efforts. If you check out our landing page, we've got a roadmap of key moments where you can see what the moment of the hour is, how the Hub is planning on supporting the community, and how you as an advocate can take action at the national or regional level. So right now we are at the multi-stakeholder hearing as a critical moment and engaging directly with missions to influence the language of the political declaration as the most critical moments right now. Next slide. So on our landing page, which I shared a chat in the chat box earlier, we have a section that has this banner on it that indicates what our current calls for actions are. So if Priyanka, if you just want to share your screen to the landing page now, we can show you how to access these resources and put to use all the great toolkits that we're developing to support your advocacy at the national level. So right now we have 4 main actions up on our website. The first main action, and I'm hoping, I think it's just taking a minute for the screen to load, but I'm just gonna run through it anyways, and hopefully it shows up on the screen in a second. There we go, right. So the first main action we have is really just a short form for people to fill in so that we can coordinate our on-the-ground participation at the multi-stakeholder hearing. We've also been using this form to try and secure additional resources to get people to the hearing. The second main ask is for you all to engage your key targets at the national level. So reaching out to your head of state to invite them to show up to the high-level meeting, members of parliament, and your representatives of your nation at UN missions sitting in New York. And if you click on any of the links that are in orange, you'll be navigated to a toolkit that has templates and in-depth rationale for why these actions make sense right now. The third key ask is for you to start to organize regional and national consultations, just like this, so that we can localize those deadly divide key asks that I showed you on screen earlier, and that we can also take stock of where our advocacy strategy is and how we can work together to make an impact on the political declaration language. And the last key ask is for you to make use of our master tracker, where we can share intel, track our advocacy action, and stay up to date with the different events and activities that are happening at the hearing. So if you click on that, there's a tab that'll show you all the events and activities in New York. And that is pretty much it for us. I'm going to hand it back over to Priyanka so that you can understand how to stay connected and engaged with the Affected Community and Civil Society Coordination Hub for the TB HLM. And we're looking forward to engaging with you more.
Thank you so much, Robin. So how to stay connected? Well, we have community deep dive calls happening every second and fourth Thursday of the month. We have another one happening on 27th of April, which is the fourth Thursday for this month. So you can go on, head over to our landing page and you can register there. And it's just a one-time registration and you will get regular calendar invites to join us as the calls happen. Apart from that, you can find us on @GF Advocates on Twitter. And you can also reach out to me on Twitter, which is @Priyanka Iyer. And I will also put down our contact details and our email IDs in the chat box for you to stay in touch. So that's all from our end. Over to you, Rosemary.
Thank you. Thank you very much, Priyanka and Robin. Thank you so much for taking us, clarifying for us, or reminding us what the date is for the TB high-level meeting, who the core facilitators are. You've taken us through what those of us at the country level, regional level can do, whether we are coming to New York or not, and really outlined for us key things, like influencing our missions in New York, visiting the missions at the Capitol, working with our head of state as champion and really pushing these asks to them. The key 6 themes from the deadly divide, thank you for flagging those, but I think also most importantly for really bringing the fact that we also have to think about how we localize those to the regional level, but also how do they look like at the country level, the 6 key themes from the deadly divide. The toolkit is very helpful, and even how we can stay engaged. So we thank you very much for that. And Florence, perhaps we can invite the next team to give us an overview of the next HLM. Over to you, Florence.
Thank you very much. I think, and thanks to Priyanka and Robin for that very informative presentation. Our next speaker will be Waiswa, who will talk to us about universal health coverage, HLM. Over to you.
Thanks, Florence, and good to see so many familiar faces here. I'll try to go through my slide as fast as possible, since many of you are familiar with this material from other meetings that we have been together. My name is Waiswa Nkwanga, and I'm the Senior Technical Advisor and Coordinator of the Civil Society Engagement Mechanism for UHC 2030 at Management Sciences for Health. The CSEM is co-hosted by Management Sciences for Health, MSH, and WACI Health. Next slide, please. So quickly, I'll give you a quick background. I don't want to take it for granted that everybody knows what the UHC HLM, how it came to be. So I'll give you a quick background on that, and then I'll walk you through our sort of key asks, the action agenda for the UHC movement, and then we will look at how you can use it in your advocacy, and if there are questions, we'll take them at the end, I guess, of this presentation or the presentations. Next slide. Great. So the UN high-level meeting on UHC, as you all know, will take place on September 21st this year, and it will be co-facilitated by the Republic of Guyana and Thailand. And this high-level meeting came about back in 2019 when the UN General Assembly held its first high-level meeting on UHC that resulted in a very comprehensive set of political commitments. And in it, the world leaders agreed to hold a second high-level meeting on UHC in 2023. It just so happened that between then and now, we had COVID, which made it even more urgent for the second high-level meeting to be held. And so here we are looking to, we're starting to mobilize everybody, all stakeholders, to participate and engage in this process to make sure that we have the highest political representation in New York in September, on September 2021. Next slide, please. Okay. So what have we done? What we've done in preparation for the high-level meeting in September is to develop a set of key asks, or we call it the action agenda from the UHC movement. And this was developed with the help of a task force that was put together by UHC 2030 that really represents not only the consequences of UHC 2030, but also the stakeholders that are mentioned in the modalities resolution for the high-level meeting. And so that includes the private sector, government, member states, civil society, researchers, members of parliament, local governments. Those are all mentioned, and they were part of this task force that put together the action agenda. This work started in September last year, and then sometime in January, it was opened up for public consultation online. And the CSM back then held about 3 different webinars with civil society to try to walk them through this consultation. And we received a total of over 800 responses from all stakeholders. And so it really represents the views of all stakeholders in this process. And then it's also builds on the 2019 political declaration. This year's process is not, we're not starting from scratch. We already have a really good and strong political declaration. And so we felt that we needed to build onto that then integrate some of the research that has been done in recent years from the State of the UHC Commitment Review and other sources. So that's what we did to develop this action agenda. And it will be presented to the President of the General Assembly ahead of the multi-stakeholder hearing next month from the 8th through the 9th of May. And then it will be one of the pieces that will be used to develop the zero draft for the political declaration in UHC. Next slide, please. And so, one of the questions that we keep getting is why was this developed? The action agenda, but also why the second high-level meeting on UHC. As I mentioned earlier, the second high-level meeting on UHC was, in fact, highlighted in the first high-level meeting on UHC in 2019. But we also know that we are living in different times now. Even before COVID, we were struggling to be on track, to get on track in terms of the commitments that were made in 2019. And then COVID came about and pushed us even further behind. We're nowhere near reaching the 1 billion people with essential health services, and more than half of them really lack it. So it's a very, very difficult time that we're in. We're seeing more and more vulnerable people falling behind and not having access to the health services they need. We also seeing that more people are suffering from a catastrophic cost to access health services. So it is very, very important at this moment for us to bring together world leaders to recommit to accelerating progress on the UHC. Next slide, please. So as I said, it's a very unique opportunity. We want leaders to renew their efforts to accelerate progress in the UHC. We want to make sure that we have, this time around, we have concrete actions that we can hold leaders accountable to. And, because of the new situation with health, with pandemics and all of that, we want to make sure that we strengthen the connection between UHC and health security, and making sure that investments in equitable, resilient health systems are made going forward. Next slide, please. Okay, so again, this is where we are. I think this is a long, next slide. So what is in the action agenda? In the action agenda, we laid out 8 action areas that we think requires urgent action. For some of you who participated in the 2019 high-level meeting on UHC and the lead up to it, some of these things might look familiar, and in a little bit, I will talk about what has changed But we do think that looking at the first one on political leadership, we have all seen this, that there's nothing that can be done without leadership at the highest levels. COVID has shown that very clearly. And what we want now is to make sure that governments commit to providing strategic leadership to champion universal health coverage as a national priority, political priority in their countries. We also want to make sure that there's a focus on meeting the needs of the vulnerable and the disadvantaged groups and providing care for them throughout their life cycle, and are also that will remove barriers to accessing health services, especially for those groups that are left behind. Action area number 3 talks about the enabling laws. Really is looking at how we can integrate and bring in and support the development and creation of new technologies and innovation that we need to be able to not only scale up UHC, but also respond to health emergencies when needed. So this is an important piece that the task force really brought into, strengthened in this iteration of the 2019 key asks. On action 4 on strengthening the healthcare workforce, this is again something that we have all seen during COVID, that we need a strong health workforce to deliver care to people, especially those in difficult to reach communities. And so once again, it's been strengthened here. And investing, we can't say enough about what's needed in terms of investment for UHC, but also for TB and PPR and other health issues. We need more investments in health overall. And the action agenda has laid out specific numbers that we think, or targets that we think government should commit to. And then number 6 on moving together toward UHC, really ensuring that everybody is involved in this process. We believe in a participatory and governance of health, and that civil society and communities and all stakeholders are involved, not just in consuming what has been developed, but also in informing the process that leads to developing new tools, that leads to making decisions, evaluating programs. All of those processes want to make sure that our leaders commit to creating structures to enable that. And then on gender equality, this is another issue that has been strongly highlighted, and also the connection between universal health coverage and security. Next slide, please. So what has really changed from the 2019 is that we have intentionally made the action agenda action-oriented, very specific. We have specific actions that we want leaders to take action on, and also milestones to measure progress. We've emphasized our vulnerable groups. We have emphasized the role of healthcare workers. We've emphasized also gender equality, and also strengthening the connection between UHC and health security. So that's really, those are the 3 or 4 main areas, 5 main areas that have changed in this iteration of the action agenda or the key asks. Next slide, please. So how do you use this? Next slide. So, the action agenda is available in French and English. That's the long document, but we also have short versions of that in other languages. And we've also developed some tools to help with people sharing the action agenda and using it in social media and other spaces. So please go to the UHC 2030 website, and I will also share a link shortly in here to see some of the resources that we have developed. Next slide. So the other question that people ask about the action agenda is, how do we use it? What does it mean for me at the country level? Really, use this to make your voices heard by influencing your government's, your country's approach to UHC, make sure you use it to advocate to your government, to show up in New York on September, and not just health ministers. They're very important and as well, but we want to make sure that heads of states show up in New York, and that they show up with a delegation that includes civil society and members of communities. And also, make sure that they don't just show up, but that they are committed to making strong and ambitious commitments when they show up in New York, and that we hold them accountable after the HLM. Next slide. Okay, so these are the various ways that we think that would be helpful for you when you're using this tool, making sure that you use it. So the way the action agenda has been designed is that this is a global document, and it was made it in that way intentionally because we wanted to make sure that people can take it and apply it to their own context, to their own disease area, to their own health area, or even beyond health. And so take it, align it with your issues, align it with your country context, and then share it with your policymakers and decision makers, and use it in other spaces. It will be a hearing next month. And so making sure that you take some of the messaging there to inform your positions in the multi-stakeholder hearing, and also in other spaces like a G20, the INB, G7, and other global, regional, and country opportunities that you have. Next slide. A little bit about the multi-stakeholder hearing on UHC. The previous speakers have touched on this. This is sort of like what it's going to look like. So we have all three multi-stakeholder hearings held across over 2 days. The first one will be on the 8th, and will be TB. On the 9th will be the PPPR and the UHC. The PPPR will be held in the morning, and then in the afternoon will be the UHC. And then for the UHC one, we will have two. Panel discussions that will feature civil society members and members from the communities on the topics of driving UHC as a driver for accelerating health for all, and another one on from commitment to action and accountability. The CSM has been, I'm happy to say that we have been able to secure a couple of speakers in these panels. And so we'll have some civil society voices in these panels and during the hearing. Next slide, please. So this is what's coming up, some of the opportunities for us to engage, to continue to share the action agenda. The World Health Summit World Health Assembly, definitely an important moment where many of us are going to be, and so it's an opportunity for us to continue to share these key asks of the action agenda and other resources. I will stop there in the interest of time, and back to you, Rosemary. Or Florence.
Thank you so much, Waiswa. That was very, very useful. You have told us why this is important. I think everyone is interested in knowing how can we be better champions of UHC. You have shared with us that we need to take the action agenda and share it with people, make it context specific to our countries, and reach out to our governments and missions coming into New York for the negotiations to try and ensure that countries make ambitious and a good commitment, but also beyond that, organize ourselves around keeping our countries accountable. Thank you so much. Next, I'll take this opportunity to welcome you, Fitzel, from WACI Health, to share with us more on the pandemic prevention, preparedness, and response. Over to you. Thanks. Oh, please look at the chat box for any resources and links that are being shared. if you want to engage further with the high-level meeting and meetings and all that everyone is organizing around. Thank you. Over to you, Fitzo.
Thank you very much, Florence. Thank you to the wonderful presentations that were made ahead of me. My name is Fitsum. I'll be presenting on the high-level meeting on pandemic preparedness, pandemic prevention, preparedness and response. Yeah, so I'll be taking you to the timelines or what has been achieved so far. So on the 9th September of 2022, the General Assembly adopted a resolution to convene a high-level meeting on pandemic prevention, preparedness and response. And October 19, 2022, President of the General Assembly appointed the ambassadors of Israel and the Kingdom of Morocco as co-facilitators to lead the process. And on the 24th of February 2023, a General Assembly adopted a resolution on the scope, modalities, format, and organization of the HLM on PPR, which we'll touch on it a bit later. And on the coming May, there will be the multi-stakeholder hearing on PPR, also on TB and UHC. From June to July 2023, there will be negotiations happening on the political declaration. And on the 20th of September, there will be the actual high-level meeting on PPPR. So what are the modalities? The entire goal is to further mobilize political momentum, including through the integration of a multi-sectoral approach towards pandemic prevention, preparedness and response. The participation will be mostly led by member states, and it will be possibly by the highest level of member state delegation. Also, there will be UN agencies and other relevant stakeholders, including civil societies. So the expected outcome of this UN PPPR HLM is to have a concise and action-oriented political declaration. There is also a need for a multi-sectoral and whole of government and whole of society approach. Also, it should be acknowledged that the key leadership of the World Health Organization within the broader UN response. Also, there should be importance of ensuring coordination with other organizations of HLMs, such as UHC and TB, and also to ensure action-oriented health agendas, as well as looking forward to the HLMs on antimicrobial resistance in 2024. There is also interconnectedness between Geneva and the New York PPPR, and also the process including international health regulations and work of the intergovernmental negotiating body to draft and negotiate a convention, agreement, or other international instruments, or known as the Pandemic Accord or Pandemic Treaty. So what's the format of the September HLM? There will be an opening statement, which will be done by the President of the General Assembly, by the Secretary General, WHO Director General, World Bank President, and also possibly a higher level champion on PPPR. There will be a plenary segment for general discussions. There will be also two multi-stakeholder panels, which we'll see them later, based on a theme, and which will take into consideration the direction and outcomes of proceedings and ongoing PPPR process and initiatives, as well as interactive multi-stakeholder hearing. There will be also a brief closing segment, which summarizes of the multi-stakeholder panels and a concluding remark by the President of the General Assembly. So, there will be two panels. Panel one will be more on lessons learned from the COVID-19 pandemic, which will be the case for pandemic prevention, preparedness, and response. It will be a multi-sectoral engagement with a team of Leave No One Behind, and also we'll be looking into disinformation and also looking how we can have correct information. Panel two will be investing in pandemic prevention, preparedness, and response. It will be more of looking into local capacities, developing of national policies, maybe looking into local manufacturing and other issues, but also looking into financing. These are the resources that are available to further acquaint yourselves with the process, and I believe we will also share this for your consideration. Thank you very much. Back to you, Lawrence.
Thank you so much, Fitsam. This was very, very useful, with many of us not really quite understanding the pandemic, the PPPR high-level meeting process. It's a new mechanism. All of us are questioning how can civil society really engage and organize around this. I'm excited that the panel, of the two panels, one of them is themed around leaving no one behind. And I believe that is an opportunity for all of us to ensure that our messages are aligned and target towards showing how we leave no one behind. I will take this opportunity now to hand over to you, Rosemary, to welcome our next presenter.
Thank you so much, Florence. Really great updates. As we set out, the objectives for this webinar is really to get updates across the 3 high-level meetings in terms of dates, modalities, who is co-hosting, how do we engage as civil society. And so, Florence, speaking of panels, we have a colleague here on the call, Cindy Kelemi, who is a speaker on one of the panels. So we wanted to bring Cindy to invite you to share with us your reflection as a speaker, as a civil society speaker, during one of the panels. Maybe you can tell us what panel have you been invited to speak, any reflections, and actually also any area of support you'd like this community of communities and civil society gathered here or in your network to actually support. But also I'm sure that as we develop some key messages and positions, they will also help all speakers who might also be here, besides Cindy. Cindy, if you're on the call, please, over to you.
Good afternoon, everyone. As already introduced, my name is Cindy Kelemi, and I am based in Botswana, representing an organization called Botswana Network on Ethics, Law and HIV/AIDS, which is a partner of Frontline AIDS in the UK. So I am happy, excited, and nervous at the same time that I am one of the speakers at the upcoming stakeholder engagement meeting. I thought someone was talking, that's why I paused. So basically, I am still working around developing my speaking notes. I'm still in contact with the organizers, also to understand how much time we have available to speak. But at this time, I think mine is a call to all civil society representatives here to say if there are any issues that you really want me to raise using that platform, I will be happy to engage. So far, I've been receiving quite a number of, papers that were presented either in earlier platforms, where basically the themes are sort of the same, really, in terms of what we are asking for as civil society. For example, political leadership, community and health systems, responses and leadership, eliminating structural and systematic barriers, One Health and multi-sectoral approach to PPPR, equitable access, synergies between disease-specific programs and PPR, recommitting to ending AIDS, TB, and malaria, and also the recognition of the contribution of ATM programs in addressing COVID-19, financing, digital health, and accountability. So those are some of the themes that I will basically include in my paper, but I would love if there are some other issues that civil society would want me to raise at this platform, I'll be happy to do so. Like I said, I'm still working on developing my talking points with, of course, support from other civil society members here. But if there's something particular that you feel should not be left out, I'll be happy to include it. And also it would be great if we can agree on a process of how we can prioritize and agree on what needs to be said, so that as I make the presentation, it is based on the needs of civil society broadly. I know we cannot represent everything, but there are key issues that we may plan not to leave out. Thanks.
That's fantastic, Cindy. Thank you so much for sharing with us your reflections and the presentations here.
And I didn't show my face.
Oh, there, lovely. Good to see you and to connect. The presentations around the TB high-level meeting have really directed us to the Deadly Divide report and the 6 key themes that have been highlighted. The presentation on the UHC high-level meeting has pointed us to the 8 action agenda areas that colleagues are focusing around, and Fitsum took us through the PPR. We didn't see any like key specific themes or action agendas, and I know colleagues who are here who are working on that are preparing very well on how to engage on that. So I think, Florence, we open it up. We've had really great presentations. To a quick Q&A, comments, just quick reflections. I know we are many, we won't be able to take all questions, but feel free to utilize the chat in terms of any comments, and so, or to use the raise hand function for that. Any specific questions, point for clarification following the updates we've received for the TB high-level meeting, UHC high-level meeting, PPPR, bearing in mind that the purpose of this call is to get the updates, what's happening in that space, the dates, the modalities, what's the process like, who is engaged. If you're a speaker on any of the high-level meeting, please feel free to also share that with us on the chat, but wanted to take this moment for us to take a pause and see if we have any questions or things that might need clarity. Olaide, I see your hand is up. Over to you.
Thanks, Rosemary. Good afternoon, everyone. So I heard about the multi-stakeholder consultation happening March 8th and 9th, and I just wanted to know if there is an opportunity for virtual participation, because I noticed in the form, you know, it was asking if people were going to be there physically in New York. So if people are not able to be there physically, is there an opportunity for virtual participation? Thank you. Over.
Thanks, Olaide. Peter Owiti, I see your hand is up.
Yeah, thank you very much, Rosemary, and thank you for all the presenters. I noticed that we have the 6 R's, but also there was some chatter or asked by the union conference participants, which expands it to 8. Are we merging those ones, or did we collapse them? Because one of them includes that the presidents, the leaderships must be, we were demanding that the leadership must attend the United Nations high-level meeting. Thank you.
Thank you. Let's take one more. Richard? Richard Obedi, please unmute.
Yes. Thank you, madam. Are you getting me?
Yes.
Hello, are you getting me?
Yes, you're breaking,
yes,
but
I'm sorry, I'm in a noisy place. But I try to be a little bit audible. Yes, my name is Richard International. We're based in Uganda. It's actually policy research and advocacy civil society organization. Work on a number of health-related issues. Now, when one of the presenters was making presentation on how civil society should be brought on board, I want to give you, in a very short period, I want to give you a place just in March during the UN conference, the way civil society were actually subjected. Even when you try to send your accreditation, you are actually sent to Uganda US mission and from there, then you're bounced back into the country. So I would like this scenario should not happen in the September meeting, because some of us actually intend to attend this meeting physically, and we should interface with government member states. So I would like, actually, it was Waswa who made the present, who alluded to that. Let civil society, let the accreditation of civil society be independent of government, because, for instance, the case of Uganda, you find this, the line minister will say there's a cabinet memo that government ministers are not supposed to go out of the country. But civil society, sometimes they can afford to actually pay for their own expenditures to attend some of these meetings. And we, in the end of it all, we are denied this opportunity. Thank you.
Thank you. Thank you so much, Richard. We shall reflect on that. Florence, do you see any question on chat before then we can get a response to all four?
Yes, there is one from Arnold Masawe. How can, I think he meant not developed countries, ensure they meet the targets of universal health coverage due to insufficient budget allocations? Richard just spoke to his point, which was also on the chat. Okay, over to you.
Awesome. And Levi, we see your question around comrades working on UHC, any plans to reach out to friends of UHC. So let's start with Robin, and then we come down to Waiswa and then Fitsum, taking the questions that you're able to respond or are within your portfolio. Then we can go to the next step. So Robin?
Yeah, great. So just a quick note on virtual engagement for the hearing. So we know that they're going to be live streamed by the UN, but that doesn't allow for active engagement from online participants. So Stop TB is working on pulling together a Facebook Live event for the TB multi-stakeholder hearing so that people who are viewing online can engage with each other in an online forum, and those engagements can be captured and fed into the process in other ways. So that's just to the online nature. And then Peter, to your point about heads of states participating in the high-level meeting. So I know that in 2018 for the TB high-level meeting, there was a really big push on getting heads of states to show up. And of course, we want that to happen again this year because it demonstrates a level of political commitment to the cause. But I think it's more important to ask the state to show up with some sort of new commitment or plan. And again, looking back at 2018, not very many countries showed up to the TB high-level meeting with something substantive, which was a bit unfortunate. So this year, we really want countries to show up and bring something new to the table. In 2018, for example, the US launched a new TB R&D strategy that of course would have come with funding. They also launched a new accelerator program through USAID, which of course would have come with some money. So we want states to show up and commit new things at the high level meeting, more so than having their head of state there necessarily. So your advocacy at the national level right now should be going to members of parliament, going to heads of states, going to other allies and saying, hey country, in Canada, because I can speak to that, last time you launched a regional specific TB elimination plan for Inuit Nunavut. This time, can you show up and launch a national TB elimination strategy and plan? So at the national level, really start thinking about how your country can show up and champion ending TB and try and make sure that that happens. So it's not just about who shows up physically, but what shows up.
Thank you. Thank you so much for that. Waiswa?
Hi, thanks to the gentleman from Uganda about the question you raised around accreditation. This is an issue that has been raised, was raised at the beginning of planning for the multi-stakeholder hearing. And it's the reason why we pushed so hard to make sure that even the multi-stakeholder hearing, we don't have this kind of challenges for civil society to participate. And so it's an open, it was an open registration. You don't need to go through the accreditation process for the multi-stakeholder hearing, but we still don't know about the high-level meeting itself. And so it's something that we, I promise I will raise to UHC 2030 to look into because it's just not good for us. I'm going to share my email here. If you want to follow up with me on this later, please, that's my email. On the question around UHC funding, so in the action agenda, we have made sure that we include specific targets on funding. This was really controversial because, different countries at different levels of development. And so if you say 5% or 10%, it doesn't apply to every country. And it can also be a demotivator for countries to do more. And so we had to go back and forth on this, but we have included a 5%. We had to include something for at least low and middle income countries to as a target to hold them accountable to. And so we included 5% GDP allocation to health. And so I hope, and we hope that that ends up being agreed upon at the high-level meeting, but it's there. And then on Levi's question around the UHC, Friends of UHC, I think the best way to get in touch with the group of friends, because there are more member states group, is to go through UHC 30, the secretariat, and you can email me. And if you don't have the contact information for UHC 30, I can connect you with them. On that.
Thank you for that. Yeah, thank you. So Fitsum, maybe your quick reflections, and as you do that, Fitsum, if you could also mention any African Union related consolidated process for any common positions, the process and all, and then maybe turn to Florence to talk about any other regional pieces that are happening, like within the UHC, anything, Florence, that you want, but Fitsum first.
Thank you very much, Rosemary. I was disconnected out of audio for a few seconds, but I believe the question is more to follow up on some of the questions raised, and I have heard from participants on a meaningful CSO engagement, especially looking into the HLMs, and I'm also looking into some of the works we have done, especially with the African Union and Africa CDC. I believe there are some examples that we can use. For example, we have tried, and we are also continuing to reach out to the African Union and Africa CDC as civil societies, whereby we're trying to input to the processes, ongoing processes, especially on the common positions on the three of the HLMs, PPR, TB, and UHC. And also we are seeing quite good progress in terms of the PPR agenda, which is now being led by Africa CDC. There have been also a very good interest from African Union Commission in terms of coming up with common positions on UHC and also on TB. For UHC, there is also an approach that was taken by Africa Union Commission, sending out surveys to member states to really come back with their inputs so that it can also form a common position on UHC. The same process also can apply for TB, and we're also pushing as civil societies to do that. There is also a thinking from the African Civil Society constituency to kind of also come up with African civil society common position on the three HLM processes. So we are also kind of discussing on those and how it can be done. So once we also have, it's good that we have a very good participation on this call. We will be using the same experts in the room to adopt, to kind of form that common position on the HLMs, but especially more so on PPPR and TB and UHC. Thank you very much. Back to you, Rosemary.
Thank you, Fitsum. Florence?
Yes, and definitely looking forward to working more with over 108 people who joined this call. Very exciting, and across the three HLMs. So I think what I would just add onto this is that Aidsfonds and GNP Plus, through our Love Alliance program, are working with WACI Health to look at the regional status of UHC from a HIV lens, and just focusing on the 10 Love Alliance country programs. And these include Kenya, Uganda, Burundi, South Africa, Zimbabwe, Mozambique, Nigeria, Burkina Faso, Morocco, and Egypt, just to understand where are we at now and look at key gaps, particularly around HIV service delivery, looking at populations that are most affected by HIV, and coming up with recommendations which we believe will get organized around and used within the Africa Union, Africa CDC conversations across the 3 HLMs. So also look out for that. I see some of the Love Alliance colleagues on call here, who I believe Fitsum and Rosemary are in touch with. So more on that. If you have any questions, do feel free to reach out to us as well. Back to you, Rosemary.
Thank you so much. And those are not the only like regional processes going on. So if you're here and you know of a regional process going on, maybe you're in a partnership, you can either put it in the chat or you can talk about it in the next round when we go into the groups, which are just about to go now. But I see Waiswa, you have your hand up, so didn't want to close.
Yeah, I just wanted to quickly flag that we now have a schedule for the negotiations on the political declaration for all 3 political declarations, starting with the TB one. It's expected to come out on the 12th of May, the UHC one on the 22nd of May, and then the PPPR one on, I believe, June 7th. So I'm going to share a link here, but it means that we need to move really quickly to start influencing these processes as early as possible. That's all.
Awesome, fantastic. So what I see many questions, Florence, here on what we can do at the country level as well. I'm seeing colleagues saying, how can we be more vibrant? How can we drive the momentum? And I know it's not just for the national level, it's also like regional as we feed into the global. And so this next session, you know, about 15 to 20 minutes, we structured it so we could go into groups, splitting ourselves across the 3 high-level meetings. I know many colleagues here are working across all the 3 high-level meetings, so you might be asking yourself, which one do I go to? Which one do I not go to? Just pick one, I think, for purposes of organizing ourselves. The intention of this session is to begin to think about how we localize the messages. For example, with TB, we have the 6 key themes. How do we localize that? How does that look like at a country level? Do we have specific asks that maybe make sense at country and regional level, which if we don't get right now, they will be missed when we come to the global level? It's the same for UHC. How do we localize the agenda action? How does it look like at the country level? And we're also conscious that there is a global process going on that is working on a consolidated statement across all the 3 high-level meetings, but we want to be sure that it can be reflective of communities and civil society inputs and points of view from the region, from the region, and definitely from country level. So that's what we are going into. Courtney is supporting us in the back end. So Courtney, you will be helping us to get into the breakout rooms and into timing. Thank you.
Thanks, Rosemary. Hopefully everyone's received an update. If everyone can select a room, either on the TB, UHC, or PPR, and then you'll be assigned to that room. Anyone just joining us, or if you're in the main room, please do select which breakout room you'd like to join across the 3 different HLMs, and you'll be moved into that room just for the next section. Thanks. Hi, everyone. If you're just joining us, or if you're still in the main room, please do select a breakout room to join for the next sort of 15 minutes. You can either move to the TB, the Universal Health Coverage, or the PPR Pandemic Preparedness Group. It should be showing up on your screen, but if you're having any problems, please just let us know in the chat and I can assign you to the room that you'd like to join. Thanks. For colleagues in the main room, again, if you'd like to join a breakout room to discuss either TB, universal health coverage, or pandemic preparedness, please do select the rooms that are showing up hopefully on your screen. If you're having any problems, please do, as colleagues are doing, just put it into the chat and I can assign you to those groups. Thanks. Colleagues in the main room, again, if you'd like to join a breakout room, please do either select the options on your screen or put it into the chat. I'll be joining the PPR working group, but I will be able to still monitor this list. So if you would like to join, have any problems selecting which one you'd like to join, please just message in the chat and we will add you. Thanks. For colleagues who are just joining us in the main session, we're just going out into breakout rooms on TB, universal health coverage, or pandemic preparedness, the 3 topics for the HLMs. So if you would like to join one of the breakout rooms, please just put a note in the chat and we'll make sure to add you into that group as well. Thanks. We'll be coming back in around 5-10 minutes into the main session. Hi, everyone. For colleagues who are in the main room at the moment, if you would like to join a breakout room, we're currently in the different rooms discussing the different high-level meetings, so on TB, universal health coverage, and pandemic preparedness. If there is a particular room that you'd like to join, hopefully you'll have the option showing on your screen at the moment to join one of the rooms. And if not, please do just put it into the chat and I will make sure that you're added into the group that you'd like to join. Thanks so much.
child with TB needs to stand alone. Apologies to my team. We just got zooped up and we are back.
Yeah, that time was too short. Rosemary, you know TB is big, but I would have given us additional time.
I know.
Yeah, that time was just too short.
I found myself alone, but please do note that you can still give your input on the form, or please just email it to us if you have something that is in writing, and we can definitely add on to the document, which we will share with you. You have until 27th, if I'm not wrong, you have until 27th to share your input to the document. And yes, you can share this document with your peers and other networks. Yes, you can do that. Thanks.
Yeah, Florence, I think in terms of time, it was limited, but I think it works well in terms of helping us to kickstart a conversation. The document is open up until Thursday this week. And I'll just turn to I think Courtney, to maybe speak a little bit about how the regional position connects to the global, and also to mention about the pre-meetings ahead of the multi-stakeholder hearings in New York. Courtney?
Thanks so much, Rosemary and Florence. Yeah, so as we've been discussing, and apologies, that was me sending everyone back to the main room from the discussions in the breakout rooms. And I appreciate it was a very small amount of time. So in terms of linking the kind of statement, the CSO statement and the regional statement that's been developed this week, there's also a couple of sort of ongoing pieces at the kind of global level to bring together key asks around the sort of 3 HLMs as well, which very much follows the format in the regional statement as well, around the same kind of themes and sort of what the kind of key asks are. And the intention with that piece is to sort of finalize it like at the latest sort of early next week, so that it can be shared ahead of the multi-stakeholder hearings with our broader networks, as well as sort of decision makers, governments as well. So once the regional statement is finalized with everybody's input, the idea is that obviously that will be then cross-referenced into the global one. So the global statement very much wants to make sure that we're linking into what the key recommendations coming out of this regional consultation are, and also connecting with partners sort of globally in different regions who I appreciate are also doing their own kind of consultation processes. So yeah, once maybe the regional statement's ready, we can share that global document and share how it's sort of been input into it. Very much would welcome colleagues to sort of work with us to develop that global statement as well. It's very much a collaborative effort of us all coming together across different themes. And then that will then obviously be shared for sign-on following the multi-stakeholder hearings once we've updated it with any sort of key pieces that we may have missed, but that we want to include following those meetings in May. Thanks.
Absolutely. And there was one question earlier on how do we stay connected? So there was a comment that we have many of us working in our different high-level meetings, and I think just a few of us are cutting across. So if there is any group already set up, there was a colleague who was saying, is there like a WhatsApp group for people who already know they are going to be in New York, so that colleagues from the region can also be added in that WhatsApp group? If there's something like that, I think it will be great for people to also drop their contacts in the chat. If you know any co-organizer here, maybe Florence, Courtney, myself, friends at Aidsfonds, or all colleagues, CSEM, you can drop your email and say, hey, I'm going to be in New York. Kindly put me in the WhatsApp group for communities and civil society who are going to be in New York. So look out for that. So that brings us to the end of our conversation. I will turn to Florence to see if you have any quick closing thoughts. You're on mute, Florence.
That happened to me, sorry. I wanted to say, I think in terms of just clear next steps, we would like to keep this momentum going. And thanks so much for letting us know what to do with the statement, and Courtney as well. I think what I just wanted to say at this point is we would like to really connect this to the work that will happen at global level. We would like to connect it with the work that's happening in different regions and see how there's in alignment and coherent community asks across the 3 HLMs, but also across the world. Now, in terms of organizing for the multi-stakeholder hearing, GNP+, GFAN, WACI Health, Aidsfonds, and lots of other colleagues are organizing a pre-meeting scheduled for the 8th of May. And if you're going to be in New York, please do reach out and let us know you will be there so that we can know who you are. We have organized and will be hosted by UNAIDS in New York on the 8th morning. We'll share more details on this, so please be on the lookout for that. We are hoping to make sure this meeting is hybrid. For those of you who will not be able to make it in person, really trying our best, but at this point, just to note that there will be a meeting and a coming together of civil society with this document that we are hoping to prepare together, just to have some drafts and key coherent messaging, but also to just get us also in touch with people who are representing us on the different panels. So I think I wrapped through that, but if there's anything that I can help make clear, do please reach out to me or to Rosemary or to Courtney. Yes, so with that, I think I should give it back to you to close, Rosemary. And thank you everyone for being here.
Thank you, Florence. I see colleagues asking whether the slides will be shared. Yes, by you joining this call, you registered through a particular process. So I believe the info is there, but also many of you have shared their contacts here. So yes, the slides will be shared. Some colleagues are asking, so what's the way forward? What are the next steps? As Florence has actually outlined that, but I think most important is to know the inputs and the thoughts that have come out of here are being put into a key asks document, which we will close on Thursday this week for a common position, one on TB, one on UHC, one on PPR, and then cross-cutting, and then it will feed into the global key asks document. So that's the way forward. We thank you very much, and we thank you to all the organizers, our simultaneous interpreters at Tamarind. Thank you as always. Have a lovely day, Father. Thank you.
Thank you, everyone.
Thank you. Bye.
Thank you, everyone.
Thank you.
Thank
Bye.
you.
Bye-bye.
Thank you.
Everyone.
Bye.
Thank you.
Thank you.
Thank you.
Bye.
Bye.
Thank you. Bye-bye. Bye. Bye-bye.